without the Medicaid supports, we wouldn't be able to live in our own home. We wouldn't be able to live together. So that's really important to us, and I think important to most people. And so it's very personal to me when people talk about cutting Medicaid because of the impact it'll have on our lives.
Welcome to a community conversation on Medicaid and disability. In this conversation, we're going to discuss block grants, cuts, and state flexibility in Medicaid program. This slide illustrates that Medicaid has 3 different types of services that are covered. There are mandatory services, of which there are 15, and these services are required by federal law to be included in every state Medicaid plan. There are also a list of optional services, 28, that are available to states if the states choose to include them. So states can either have these services covered in their plan, or they can choose to exclude them from the plan. And then we have waiver services. Waiver services are actually created and defined by the state. They're only available to particular populations that the state determines, and they're only available up to the amounts that the state decides to limit them. An example of federally required services are typical services that you might find in a private health insurance policy such as Blue Cross or Blue Shield. They are things like inpatient and outpatient hospital services, home health services, physician services and visits, health clinic services, certified pediatric family nurse practitioner services, and nurse midwife services, and laboratory and x-rays. All items that are available for medical treatment and covered under typical private medical insurance. The optional benefits in the Medicaid program include things like prescription drugs, clinic services, physical therapy, occupational therapy, respiratory care, podiatry services, dental services, eyeglasses, and a list of other services on the menu, 28 in all. These services can be chosen by states to be included in the state plan and covered by the state, but they are defined by the federal statute and federal rules. If we divide Medicaid up into medical coverage, typical of policies like Blue Cross and Blue Shield, we'll find that these are mostly mandatory, and a few, like prescription drugs, are optional. These mandatory services are available to everyone who's on Medicaid. In addition to that, we have some long-term supports and services. These programs are typically not covered in private health insurance, and they are available only to people with disabilities. In fact, they're only available to people with disabilities who have difficulty being able to live independently on their own. These are people who need a particular level of care. So these long-term supports and services like certified family homes, habilitative intervention, and supported living are all optional services or waiver services. In fact, most home and community-based services in Idaho are covered under waivers.
Being supported, I think that both the way Lark and I have by our parents really taught us to be independent. So it's really hard to imagine what life would be like without community-based supports. I think, frankly, it's not a life that we want. It allows us to be independent, to be together. Or like everybody else. Just want to be able to make choices in our lives. Yeah. And we can't do that if we can't live in our own home and decide when we eat and where we go. And
So let's look at what type of flexibility states have. Under the current Medicaid system, states have the control over the services that are offered, except for mandatory services. States control the eligibility for waiver services. They can be made available only to people with certain disabilities or only to people with certain severity of disability. States can control the waiver services. That is, they decide which services are offered to people who are eligible for the waivers. And states have control over the provider qualifications and the rates of reimbursement. Under the current system, whatever Idaho chooses and includes in their optional and waiver services, the federal government is obligated to pay 70% of all of the service costs incurred by the state. Under block grants, things are only slightly different. Looking at the bills that have been introduced in the last few years that would block grant Medicaid, we can see that they maintained the mandatory services, so there was no change or increase in flexibility there. They didn't make any changes about the control over choosing which optional services states are allowed to have. States still control the waiver services in the same way that they do under the current system, and states still control provider qualifications and rates in the same way that they do now. The only difference is that federal government is no longer obligated to pay for 70% of all the service costs. Under a block grant, the federal government sets a limit on the amount of contribution they will make to a state's Medicaid program, and no federal payments are made once that limit is reached. In previous bills in Congress, we've seen that that limit is set on a calendar that decreases the amount of federal match that's available over the years. In Idaho, the Medicaid program spends 97% of its appropriation purchasing directly services and treatments. They only spend 3% on overhead or administrative costs. It's very clear from this slide that you can't get savings in the Idaho Medicaid program by trying to cut red tape or bureaucracy. The only way to make meaningful savings is to cut the services that are covered by the Idaho Medicaid plan. So how much flexibility is left to us? There's no improvement under a block grant to reduce the cost of administration because they're already at 3%. We haven't achieved any greater flexibility about choosing mandatory services. We still have the same flexibility we had with waiver services. The difference is we no longer have the flexibility to insist that the federal government pay its fair share of 70% of the cost. So under a block grant, the state actually has reduced its flexibility. If the state is forced to cut services, then that cut has to come out of one of the optional or waiver services. We can't make cuts to the mandatory services. This means that those categories that are available for people with disabilities that help them to live independently, the home and community-based services, are the easiest target. And they're going to be the first on the firing line in the event that federal block grants lead to substantial reductions in federal funding. We're concerned that federal block grants pose a threat to services for people with disabilities because they create an incentive to reduce services in order to replace the loss of federal funds.
One of the things that I've heard a lot in talking about Medicaid is, can the faith community step into this hole, or how is the faith community addressing this? And there's a couple things I sort of think of with that. The first is, in my role at Corpus Christi House, at the homeless day shelter in Boise, we are constantly being asked for help with requests medically. And I see sort of from that seat how many things different churches are doing to try to fill holes. So there are a few unique situations where churches might be able to step in for one individual who's part of their community, who they know and love. But for the thousands of people who are not part of those communities, where are they to turn?
If you're going to take away community-based supports, most people with disabilities like ours end up in institutions or nursing facilities, even at young ages. I worry that once you cut the Medicaid supports for community supports, that's going to be the alternatives that they go to. And it's not a place either one of us want to live, I don't think.